You're 72, feeling great, no pain, no problems. Then your doctor calls. Time for your routine colonoscopy and your stress test and your PSA screening, all mandatory at your age. But here's what they might not tell you. Major medical organizations now quietly recommend against these 3 tests for healthy people over 70. And the research shows why these screenings often find diseases that would never hurt you, spark expensive treatments you don't need, and leave you weaker, more dependent, and sometimes in the hospital recovering from the prevention itself. In this video, you'll learn which screening tests are worth your time after 70, which ones to politely refuse, and how to have the conversation with your doctor that protects your independence and quality of life, not just adds years of medical procedures. Let's go. The core problem: why screening math breaks down after 74. The problem isn't that screening tests are bad. The problem is that the cost-benefit equation changes with age. Think of screening like an early warning system. For someone at 55, finding disease early makes sense because they have 30 plus years to benefit from treatment. But at 75, that math flips. According to leading medical sources, most cancers found through screening, colon, prostate, breast, grow slowly. Research shows it takes over 10 years for screening tests to prevent even 1 cancer death among 1,000 screened people. If you're 75 with a healthy life expectancy of maybe 10-15 years, a disease that takes 12 years to become dangerous might never touch you. Meanwhile, the test itself carries immediate risks: infections, bleeding, heart stress, dehydration. And if the test finds even something harmless, you're pulled into a cascade. A positive finding leads to a biopsy. The biopsy leads to diagnosis. The diagnosis leads to treatment. And by then, you've traded feeling healthy for feeling like a patient. This is why screening harms that are more prevalent in older adults include those of the test itself, disease labeling, inaccurate test results, overdiagnosis of disease, and harms of treatment. The real insight: at 70 plus, the biggest benefit often isn't living longer, it's staying active, independent, and free from medical trauma. The 3 tests worth reconsidering, plus real risks. Test 1, routine colonoscopy. After 75, you feel fine. Your colon has been fine for 10 years. Your doctor still insists, colonoscopy to stay safe. But here's the reality. After age 75, on autopsy studies of older adults, 10-33% incidentally have polyps and 2-3% have colon cancer, suggesting the more we look, the more we will find. And the risks? Complications from colonoscopy include perforation and major bleeding, with higher rates in persons aged 60 and older. A perforated bowel can mean emergency surgery. Dehydration from PrEP can trigger falls, heart problems, or kidney issues. The official word, the U.S. Preventive Services Task Force, recommends against routine colonoscopy after 75 inches people with previous normal screenings. Test 2, PSA testing after 70. If you're a man 70 plus, you've likely heard, get your PSA checked, it's quick, it's safe. But prostate cancer is the most common cancer affecting men over 70, yet 40-60% of screen-detected cancers are cases of overdiagnosis, finding slow-growing cancers that would remain asymptomatic during the patient's lifetime. This means 4 out of 10 men diagnosed with prostate cancer through PSA screening have cancers that would never have caused problems. When PSA comes back elevated, what's next? A biopsy. Prostate biopsies are associated with anxiety, pain, hematuria, bloody urine, and infections requiring hospitalization in 0.4 and 1.3% of cases. Then, if cancer is found, surgery or radiation, often leading to incontinence and erectile dysfunction, permanent side effects for a disease that might never have hurt you. The official word, USPSTF, recommends against PSA screening in men 70 and older. Test 3, stress testing in asymptomatic seniors. You should get a stress test just to check your heart. But what does just to check actually mean? When stress tests are ordered without shared decision-making and come back abnormal, the standard route of care often leads to catheterization and potentially bypass surgery, which can be technically successful but involve long, difficult recovery, multiple hospitalizations, and complications that end a patient's ability to live independently. The issue: 1 in 10,000 exercise stress tests results in sudden cardiac death or hospitalization. Testing asymptomatic patients without a history of revascularization is not recommended. And a randomized trial of asymptomatic patients 50 to 75 years with type 2 diabetes found that screening with stress imaging did not reduce heart attacks or cardiac deaths over 5 years compared with no screening. A false positive stress test launches you into an anxiety spiral and often unnecessary procedures. You feel fine before. You feel like a cardiac patient after, even if your heart is actually fine. The official word: current guidelines recommend against routine stress testing in asymptomatic older adults. What to do instead? Your action checklist. So if you skip the routine screening, what do you do? This is crucial. Step 1. Have the screening conversation. Before any test, ask your doctor these 4 questions and write down the answers. 1. Will a positive result on this test change my treatment in a way that helps me live longer or better? Asterisk. If the answer is I don't know or vague, that's your signal to reconsider. 2. What are the specific risks of this test and any follow-up procedures? Asterisk. Don't accept. It's very safe. Ask for numbers. Infection rate, perforation rate, death rate. 3. If we find something, would I want to treat it at my age? Asterisk. Think honestly. Asterisk. If you wouldn't pursue aggressive surgery at 78, why get screened to find it? 4. What do current medical guidelines recommend for someone my age with my health? Asterisk. Many doctors haven't updated their practices. Asterisk. Challenge them gently with evidence. Step 2. Focus on what actually extends healthy life. The interventions with proven benefit for seniors don't require risky screening. Asterisk. Daily movement, 30 minutes walking or activity, proven to reduce death from all causes. Asterisk. Strength, twice weekly, maintains independence, prevents falls, preserves quality of life. Asterisk. Nutrition, Mediterranean-style diet with vegetables, fish, nuts, directly linked to longevity and heart health. Asterisk. Connection, social engagement, family time, purpose, reduces mortality risk as much as exercise. Asterisk. Medication management. If you have high blood pressure, high cholesterol, or diabetes, take your meds consistently. These are proven lifesavers. These don't require doctors to find disease. They require you to build health. Step 3. Stay symptom aware, but don't catastrophize. You're not ignoring your body. You're staying tuned to real signals. Asterisk. Chest pain with exertion? That's worth investigating. Asterisk. Persistent blood in stool? That's worth exploring. Asterisk. Unexplained weight loss or fatigue? Talk to your doctor. Real symptoms deserve attention. Hunting for disease in the absence of symptoms doesn't. Step 4. Create a written health summary. Bring this to every appointment. At age X, my goal is to stay active and independent. I prefer to avoid screening tests that are unlikely to help me, but may lead to unnecessary procedures. For any test you recommend, I'd like written information on why, what it could find, and what I do with that information. This shifts the burden of proof to the doctor where it belongs. Step 5. Know when to say yes. This isn't blanket refusal. You should consider screening if asterisk. You have a strong family history of a specific cancer and feel healthy. Asterisk. You have symptoms and screening could help diagnose them. Asterisk. You have competing health conditions, diabetes, heart disease, and screening changes your management. Asterisk. Your doctor uses shared decision aids to show you the actual numbers, not just recommended. Common mistakes and final tips. Mistake 1. My doctor knows best, so I'll just say yes. Doctors practice within systems that reward testing. They mean well, but they're not immune to routine. You are the expert on your own life and values. Your doctor is the expert on medicine. You need both conversations. Mistake 2. If I refuse, I'm neglecting my health. The opposite is often true. Refusing low-value tests is taking care of yourself. You're choosing to avoid harm. Mistake 3. I don't want to hurt my doctor's feelings by questioning them. Good doctors want you to ask. They respect informed patients. If your doctor gets defensive, that's information. Quick wins you can start today. 1. Request printed guidelines from uspstf.org for any screening your doctor recommends. Bring it to your next visit. 2. Print your life expectancy estimate from eprognosis.org. Many seniors are surprised they may have 20+ healthy years, or only 5. Screening decisions change based on realistic timelines. 3. Bring a trusted family member to appointments. An extra set of ears helps you hear recommendations clearly and ask harder questions. 4. Schedule a goals-focused visit. Don't wait for crisis or routine. Tell your doctor, I want to talk about what matters most to me and how we align healthcare with that. This reframes the entire relationship. Here's what you need to remember. At 70 and beyond, less aggressive screening often means more vibrant living. Your 3 takeaways. 1. Screening math changes after 70. Tests that help at 50 can harm at 75. 2. Ask hard questions. Will this test result actually improve your life? If you're not sure, it's okay to decline. 3. Build health, don't hunt disease. Move, eat well, connect, manage your known conditions. These are the real life extenders. The best gift you can give yourself isn't another test. It's autonomy. It's the power to choose your own medical path. If this resonated with you, like this video and subscribe for more evidence-based health information that respects your time and dignity. Drop a comment. Have you ever refused a screening test? What questions did you ask your doctor? Next week, we're diving into the one screening test most seniors should prioritize and why it often gets overlooked. See you then.